This lecture will discuss the femoral nerve block. The learning objectives for this lecture include femoral nerve anatomy and indication, risks and tips for replacement of a femoral block. The femoral nerve block causes numbness on the anterior and medial thigh and a stripe of the medial leg from the knee down to the ankle. The femoral block can provide analgesia for hip fractures, as well as surgeries on the femur, patella, quadriceps tendon, and knee. Keep in mind that the femoral nerve block will not help with pain or surgery on the lateral side of the leg. Innervation for the lateral and posterior aspects of the leg are covered by the sciatic nerve. You can do a femoral nerve block to help with pain from ankle surgery, but that would only help if the fracture or the surgery were on the medial side. It would not help with any pain on the lateral side of an ankle fracture. The femoral nerve block is done in the femoral triangle. The femoral triangle is the area below the inguinal ligament, bordered by the sartorius muscle and the adductor longus muscle. At this level, in the femoral triangle, the femoral nerve gives off articular branches to the hip and knee joints. On the right, the contents of the femoral triangle are shown, including the femoral nerve, which is in yellow in this diagram. Going from lateral to medial, or from the outside of the leg to the inside, you first encounter the femoral nerve, then the artery, and then the vein. Here's a photo of what the ultrasound probe looks like during the block. As you can see, the block is done far up the leg. And the probe should be placed right below the inguinal ligament to find the proper landmarks for this block. Question: from lateral to medial, what is the correct order of structures in the femoral triangle? The answer is from lateral to medial, you encounter femoral nerve, artery, and then vein. Here's a little mnemonic to help you remember the order of the structures. From lateral to medial, you can think of navel. So N is for nerve, A is for artery, V is vein, E just stands for empty space, and then L is lymph nodes. Let's go over some more femoral nerve anatomy. The femoral nerve splits into many branches, as you can see. At about 4 centimeters down the thigh, it splits into the anterior and posterior divisions. The terminal cutaneous branch of the femoral nerve is the saphenous nerve, which travels through the adductor canal with the femoral artery and vein. In terms of what function the femoral nerve supplies, for motor, it innervates the iliacus and pectineus muscles. The anterior division of the femoral nerve innervates the sartorius, and the posterior division innervates the quadriceps muscle. In terms of sensory innervation, the anterior division of the femoral nerve innervates the anterior medial thigh, and the posterior division of the femoral nerve becomes the saphenous nerve, which innervates the medial aspect of the knee, of the lower leg, and the ankle. This diagram illustrates the distribution of anesthesia that a femoral nerve block would provide. Keep in mind that the femoral nerve block will cause quadriceps weakness. The thigh will be weak, and so anyone who receives this block will need crutches, a knee immobilizer, or help at home. They should not try to get out of bed and walk on their own because they are at high fall risk. A femoral nerve block will cause weakness in which muscle? Biceps femoris, quadriceps femoris, adductor magnus, or gastrocnemius? The correct answer is quadriceps. Let's look at the femoral nerve block anatomy. The diagram on the left depicts what you will see under ultrasound. Medial is on the left side of the image and lateral is on the right. Going from lateral to medial, again, you have the femoral nerve, the femoral artery, and then the femoral vein. This diagram also shows muscles that you will see during this nerve block. The pectineus muscle is on the medial side, and the iliopsoas is on the lateral side below the femoral nerve. There's also two layers of fascia that I want to direct your attention to. There's the fascia lata on top, and then the fascia iliaca. The femoral nerve lies below the fascia iliaca. Here's what the anatomy looks like under ultrasound. Let's list the structures. Here's the femoral nerve sitting below the fascia iliaca, femoral artery, and then femoral vein. Here are some more examples of ultrasound images of the femoral nerve block. Let's talk more about the femoral artery. When you're doing this block, you want to make sure that your ultrasound probe is high enough on the patient's leg. You know this when you see only one artery in your ultrasound image, like this example on the right. In the ultrasound image on the right, you see your ideal view with just one femoral artery. In the image on the left, your probe is too distal to where you should do the nerve block. At this point, the femoral artery has already split into the superficial femoral artery and the deep femoral artery, also known as profundus. To get to the proper location for the femoral block, the ultrasound probe will need to be slided towards the head until just one femoral artery is seen. Remember, the nerve will be lateral to the artery below the fascia lata and the fascia iliaca. Sometimes the nerve isn't very bright on your ultrasound screen, so you may need to do a slight tilt of the ultrasound probe in either direction to highlight the nerve. You can see on the image on the right, the nerve is bright. When performing the block, the needle can be passed from lateral to medial in plane, either above or below the femoral nerve. In this picture, you can see the two white lines showing the two different paths you can take to block the femoral nerve. For this block, you would use 10 to 20 milliliters of local anesthetic. Because the nerve will impact quadriceps muscle strength, the patient will be at increased fall risk. You must counsel the patient on this before performing the block and make sure that they either have help at home or have crutches or an immobilizer. Other possible risks of this block include possible nerve or vascular injury. In terms of picking which local anesthetic to use, for long-lasting pain relief, it's recommended to do this block with bupivacaine. You can do either 0.25 or 0.5% bupivacaine. If you do the lower concentration, 0.25%, the patient will have less quadriceps weakness. Here's what the distribution of local anesthetic surrounding the nerve looks like after injection. The blue illustrates what the local anesthetic would look like surrounding the nerve. You can see for this image, the provider inserted the needle deep to the nerve. Remember, you can also insert the needle above the nerve and inject there. Let's look at some more femoral ultrasound images. See if you can identify the structures. And here are the labels. The arrow indicates a projected needle path. Here's another example. This femoral nerve is slightly deeper than some of the others we've seen in this lecture. Sometimes you may need to compress the tissue or push down with the probe to make the nerve look more clear on ultrasound. The ultrasound can also be used for femoral central line placement or femoral arterial line placement. Note that the artery has a thicker wall, whereas the vein is compressible. Typically for line placement, we insert the needle out of plane, like these dotted arrows show, whereas for a nerve block, we insert the needle in plane, as this yellow arrow shows. Here is an example of a case where you could do a femoral nerve block. A 32-year-old male comes in after a motorcycle accident and has a femoral neck fracture. He has significant pain. So before surgery, you can certainly do a femoral nerve block with bupivacaine to help with pain during and after surgery. Doing a nerve block for these types of cases is ideal since it would decrease the amount of anesthetic needed intra-op and also decrease the amount of opioid or other IV and PO pain medications needed. So to summarize, the femoral nerve supplies the anteromedial leg and branches into an anterior division, which innervates the sartorius, and a posterior division, which innervates the quadriceps. The nerve lies lateral to the femoral artery and vein, below the fascia lata and the fascia iliaca, and lies above the iliopsoas muscle. The femoral nerve block can be used to reduce pain from hip or knee surgery. And for more information, check out these references.